Chapter 16 involves normative family transitions and processes with healthy child development, something we might want to all work on. Families are going to go through transitions. They're going to have adversity. Looking at core meaning. A transition for a female may be from a stay-at-home mom to a full-time worker. Adolescents, by definition, are adults in transition. Babies are toddlers in transition. Toddlers are preschoolers in transitions. And adolescents are also launching out. Couples are in transition to determine if they're going to become families or they're going to remain into a couple. Distinction between change and transition, between the self and the inner world. How do we see ourselves? How do we understand our role to be? Do we see ourselves with additions, becoming a family with a parent, subtraction, widowhood, revisions, job reclassification, remarriages? Transitional changes involve substantial qualitative, psychological, social change in one's sense of self, one's roles, one's quality of relationships. Transitions send people in for treatment. Doesn't mean the transition stays the same or they can't adapt to it, but it does push people into treatment, and people are driven into treatment. We go to doctors regularly for wellness checks. Families don't do that. Families come in when they are in distress, when they're grappling with major life changes or the repercussions that are resounding throughout the family system. A reduction in identity, a difference in lenses. You have couples who come into treatment when babies are born because both partners may not see that as being positive because the couplehood is then threatened, or the sexual relationship has become threatened. So looking at a systemic model of family processes during major life changes, marriage, birth of children, going to school, adolescence, launching of children, retirement, divorce, separation, chronic illnesses. Looking at the dynamic, the graphic on page 430 of life, stress, work, and social support, and how it's almost like a sociogram of the domains of family life associated with development. What happens to men, women, marriages around the birth of the first child? What is it like to not be an individual going to be part of a couple, a wife, a husband? Then adding a different overlay to being a parent, a mother or a father. And there, if you look at subsystems, there's the mother-child relationship, the father-child relationship, the couple relationship, and the parental relationship, and how those things all morph together to be functional or dysfunctional, to work or to not work. What happens with issues of postpartum depression, lowered self-esteem, awakening of loss of expectations, shifts in relationships with family of origin, being very far away in different states and unable to access extended family systems or support. Going from a dyad as a couple to a triad, to new generations, new roles, new relationships, changes in stress and social support, not being able to work, being out of work for a period. How long do you wait? 6 weeks, 6 months before going back to work? Who decides to stay home with the baby? Who is the better caretaker? How is our couple relationship? Is it immersed into the parental relationship? Are there inequities that are based on gender expectation, job status, salary complications, work stress? How do families find themselves being able to maintain individual self, couplehood, parenthood, and family? And how do those things and that kind of stress add to this divorce rate? 20% of all divorces occur within 5 years after the birth of first child. So a child can become into a split family system prior to ever beginning school. Half of all children with divorce have happened before the first child enters kindergarten. What about the developmental continuity perspective? Do we find and incorporate friends as family members if extended family members are not close by? What happens to the direction of effects in parenthood research? Into warmth, into attachment, into parental characteristics during pregnancy or predictors of post-birth interaction. Do they look forward to the pregnancy? Was it Um, the pregnancy more optimal than the parenthood? Was the pregnancy very difficult? Were there physical, emotional issues? What happens to families whose children transition to school? What is that a relief? Is it a sadness? What are the studies around that? What happens to children who are still left at home when some children have launched into at least the kindergarten? And what happens with the impact of people outside of the nuclear family with friends? Looking at the marital adjustment test by Locke and Wallace from 1959 is an addendum in your book, something that you can use in the work that you're turning in, as well as in your discussion post, your case study presentations, your final papers. How is that incorporated? What are family processes predicting children's adaptation to school? Anxiety, social phobia, school phobia, again, attachment issues, sleep disruptions, eating disruptions, extreme anxiety or fear of being away from parents, inability to open up the family boundaries for friends and for other types of family interactions, children meeting families and children that are extremely different, radically different than their own natural family. Is there room for that in the family boundary system? What are the messages that are sent, verbal and nonverbal, overt and covert? What are the messages about how our family works and how we handle ourselves? What are our best family preventive interventions? How do we help our families understand cognitive development, human growth development, moral development, psychosocial, psychosexual development, understanding where we fit in not only in our own family processes, whether we're normal or considered to be less than normal, we're functioning, we're not functioning, we're chaotic, we're rigid, enmeshed, engaged, disengaged, disenfranchised. Where do we fit on that continuum? Because very few families fit in just one place. Normality is a term that spans a large continuum of diversity and systemic framework. Where are we at with understanding how our family is functioning across the family life cycle, across developmental transitions, across adverse transitions, and where will we go? So thank you, and we'll pick up again.